Hey everyone, I'm Travis, Medicare and Retirement Specialist. If you're approaching Medicare, turning 65 soon, or helping someone else navigate this process, then you're in the right place. One thing I've noticed is that Medicare can feel overwhelming because there are so many different pieces that are involved. You hear about Part A, Part B, Medicare Advantage plans, Medicare supplements, prescription drug coverage, and enrollment periods, penalties, but most people never get a clear explanation of how everything fits together. So today we're going to simplify the basics of Medicare, explain how the foundation works, and cover the main decisions that you'll want to understand before choosing your coverage. So let's get started. So we're going to start with original Medicare, Part A and Part B. And again, this is going to be the foundation of everything that we talked about. So Medicare is made up of multiple different parts, but the two pieces everyone needs to start with is Part A and Part B. So Part A is your hospital coverage. So really, think of this as anything inpatient. So it could be a hospital care facility. It could be a skilled nursing facility. Part A actually covers a little, very limited for home health care coverage. And then any kind of hospice care, end of life care, that is always covered under Part A. So now the easy rule of thumb, again, is think of anything inpatient is going to be Part A. So hospital and skilled nursing facilities. Now you see here, Part A has no monthly premium. Most people don't pay a premium for Part A. As long as you or a spouse have paid and worked 10 years or 40 quarters, then Part A is going to be no cost to you. Okay, so that's Part A. Part B is, if that is inpatient, Part B, think of this as outpatient. So this is your medical coverage. This covers things like doctor visits, outpatient services, surgeries, and many medical procedures. Okay, but inpatient, outpatient. Now, there is a standard monthly premium for Part B that everybody has to pay. And that premium is $202.90 this year in 2026. If you're a higher income earner, you will pay more than $202.90. And if you're a lower income earner, there could be some additional assistance to help with that $202.90. Okay, now together, these make up the foundation of original Medicare. But one important thing to understand is that original Medicare, it's just the foundation. This is not necessarily the complete picture. One of the biggest misconceptions people have is thinking Medicare covers everything. Medicare provides excellent coverage and it's a great foundation, but there are still areas that you need to plan for. For example, with Part B, there's an 80-20 coinsurance split. So what that means is Medicare covers 80% and you're left with 20% with no limit. Okay, with Part A, you have a major Part A deductible for every hospital stay that you have throughout the year. So you can pay that deductible multiple times. The number one thing to be aware of is with original Medicare, there is not a maximum out of pocket. So what that means, your medical bills could reach an unlimited amount. So if someone experiences a major health event, those costs can become a very large concern. This is why understanding what your options beyond original Medicare Part A and Part B is so important. Once someone understands original Medicare, the next question is, how do I handle all of these gaps? Generally, people look at two main paths. The first is a Medicare Supplement coverage. Okay, and that's what we're gonna focus on right here. How that works is, this is your original Medicare Part A and Part B. There's your hospital inpatient, your Part B medical outpatient. And what you would do is you would add a Medicare Supplement or a Medigap plan, and you do need to add an additional prescription drug plan. We're gonna break this down in a little bit more detail. But the second option is what's called Medicare Advantage. And what Medicare Advantage is, also known as Part C, a private insurance company comes in and they combine your Part A, your Part B, and your Part D. They mash it all together. They call it Part C, and I have all of my coverage on one card with one company. Okay, and there are some key differences between the two. Now, this is where it's important to understand that there isn't one option that's best for everyone. The right choice depends on your individual situation. So things like your doctors, your prescriptions, how often do you actually use your healthcare? What's your budget? Do you travel? All of those things are super important when choosing your Medicare option. Some people value the flexibility and predictability of a Medicare supplement. Others may prefer the additional benefits and the structure of a Medicare Advantage plan. The goal isn't to find the most popular option. The goal is to find what fits your needs. So we're actually gonna just do a quick side-by-side comparison of how both works so you understand. Okay, it's quick side-by-side. So no matter what, I'm going to pay that Part B premium whether I have a Medicare Supplement or a Medicare Advantage. Let's really focus on Medicare Supplements here. So I'm going to have a higher additional premium with a Medicare Supplement. But what this does is this is going to provide me lower out-of-pocket costs. So it's more comprehensive coverage that you get with Medicare and a supplement. What about networks? So with Medicare and a supplement, you have no networks. You can go see any doctor in the country that accepts original Medicare. You don't need referrals. There's no prior authorizations. As long as they accept Medicare, they accept your Medicare supplement. Okay, you have the last thing here is you do need to choose an additional prescription drug plan or Part D. With Medicare, I'm gonna have my original Medicare card, my Medicare supplement card, and then my prescription drug plan card. 3 different cards, 3 different insurances. I pay a little bit more, but I have so much more flexibility, so much more freedom, and so much more comprehensive coverage. So super important to understand the differences there. Now let's talk about Medicare Advantage. So I still pay my Part B premium, that's $202.90. And then with this, I tend to have a lower monthly premium, and oftentimes it could be 0. Okay, but what does that actually get me? So now I'm going to have higher out-of-pocket costs for things like co-pays, co-insurance, treatments, hospital stays, surgeries, you name it, you will have a copay for it. I often like to think of this as a pay-as-you-go option. So I pay very, very low up front, but I pay more as I utilize the actual services. Now I have networks, so you have to choose specific doctors that are in your plan's networks. Now, one common misconception, this doesn't mean the carrier or the insurance company picks your doctors. You can keep your doctors, we just have to look and see what networks and what plans that those doctors accept, and we can find the best option that fits your needs for that. But you do have networks, and there's HMOs and there's PPOs. So HMOs are a little bit more restrictive. PPOs are designed to give you a little bit more flexibility where you don't need referrals. You can go outside of the network, but you do have to make sure that your doctor agrees to build a plan out of network. It's very important to understand that. Now again, your drug coverage is typically going to be included with your Medicare Advantage plan. So I have all of my coverage on one card with one company. And remember, you do get additional benefits when it comes to Medicare Advantage. Things like dental, vision, and hearing insurance, fitness benefits. A lot of times you get a free fitness membership, and then you get over-the-counter benefits for things like vitamins, minerals, first aid items, anything like that. So to really simplify this side, Medicare Advantage, you're gonna pay a lower monthly premium, but you have higher out-of-pocket expenses. You have more restrictions when it comes to networks, prior authorizations, but you do have a trade-off with lower premiums and additional benefits there. The biggest thing I want people to take away is this. Don't wait until you're forced to make a decision. The more that you understand Medicare before enrolling, the more confident you'll feel when choosing coverage. Medicare doesn't have to be confusing, it just needs to be explained clearly. Hopefully this helped simplify some of the basics of Medicare and gave you a better understanding of how the pieces all fit together. Remember, everyone's Medicare situation is different. Your health, your doctors, your prescriptions, and your goals all play a role in finding the right coverage. If you found this video helpful, make sure to like and subscribe so you can stay educated on Medicare and retirement planning. We've included a couple links in the description where you can download our free Medicare and retirement planning guide, 64+, and schedule a free one-on-one consultation with one of our many Medicare specialists. Thanks so much for watching, and we'll see you guys in the next one.